At Connecticut Children's, I'm the director of minimally invasive surgery for our department, which is urology. And we're one of less than 20 freestanding children's hospitals who own something called a Da Vinci-esque robot. I'll go into more specifics as to what that is. But robotic surgery is being performed at the Children's Hospital. And right now, myself and one pediatric general surgeon are the only surgeons at the Children's Hospital who are performing robotic surgery. So, I don't know if you even know what a pediatric urologist is. When I was a sophomore, or when I was in high school at all, I had no idea what a urologist was. But I'm a surgeon who, and I focus my practice on the genitourinary tract. So if it has to do with the kidneys, the drainage from the kidneys, the bladder, and the general structures for reconstruction, or some type of surgical endeavor, that's where I'm involved. If you look in Wikipedia as to the definition of what a minimally invasive procedure is, it's any procedure that's less invasive than the open surgery used for the same purpose. Makes sense? And if you look at minimally invasive surgery, you'll probably think of some of our standard types of surgery like endoscopy, which is basically using a telescope to get into a certain body cavity, whether you're looking directly in the lungs, you're looking in the stomach, you're looking in the GI system, if you're looking arthroscopically for orthopedics into the knees, into different joints. Laparoscopy is using a camera to get into the abdominal cavity, and common procedures that are done with that is taking out an appendix, taking out a gallbladder, women who have hysterectomies for uterus and ovarian removals. And then robotic surgery is kind of the newer frontier of more complex, minimally invasive surgery, which hopefully is going to lead to a lot more utilization into more complex reconstructive surgery. Some applicable procedures, if you hear about robotic surgery, you may hear people most commonly being used in the adult population for people with prostate cancer, and they do prostate removal for prostate cancer with the robot. Bladder removal for bladder cancer, they're using it in cardiac surgery for valve repairs, in GYN surgery for hysterectomies and prolapse surgeries. And in pediatrics, the primary users for the robot are the urologists. We do things like kidney reconstructions, partial kidney removals. We correct a condition called reflux, where urine's going up towards the kidneys. You can do bladder enlargement surgery, create stomas or channels into the urinary system, and you can use bowel resections that kind of overlap between our department and the general surgeons. What are the benefits of minimally invasive surgery? Well, if you're using smaller incisions to do the same procedure as an open incision, you have smaller wounds, which hopefully lead to better cosmetic results, shorter hospital stays, less need for narcotics or pain medications, and quicker return to normal activities, which in our patient population is important not only for the patient, but for their parents who usually have to take time off from work while their child is recovering. You can adjust the focus of the camera with your feet. The hands are going into these joysticks where usually it's the thumb and the index finger where you're actually pinching and grasping, and then my head is going into the console to get a view. This is just some video footage showing how the console is set up. This isn't really showing you relative to a patient. But again, down here, my feet are controlling multiple things. I have the ability to look inside the patient and move the robot with my hands. I can freeze the robot into a certain position, hit the camera pedal, and then move the camera around by using my hands to control the camera. This is the control panel that allows me to control which arm is controlling, which of my hands is controlling which arm of the robot. It allows me to change something called Tremor Reduction. So if I want my movement outside the patient to be a 1-to-1 ratio, then I can have that, or I can have a 5-to-1 ratio or a 3-to-1 ratio. That spot just showed that there's a speaker system so that when my head's in the console, the people who are next to the patient can hear me without me having to move my head in and out of the console. There's a speaker system there that allows me to hear them without having difficulty because my head's actually in the console. This just shows one of the residents here moving the instruments. You can twist it and you can see inside the body. These robotic arms can rotate fully 360 degrees. They can articulate at 2 different joints. This is some instruments that are 8 millimeters in size, but we also have instruments that are 5 millimeters or half a centimeter in size. You can really move these instruments up and down, forward and back, and rotate a lot, which when you compare it to standard laparoscopy, which I have some video of, you'll see some differences in what kind of control and what kind of finesse you have with it.